recent global outbreak of H1N1 provides an opportunity to study the use and impact of public health informatics and population health technology to detect and fight a global epidemic. Population health technology is the umbrella term for technology applications that has a population focus and the potential to improve public health. This includes the internet, but also other technologies such as wireless devices, mobile phones, and especially biosurveillance. In the context of an outbreak or bioterrorism attack, biosurveillance may help to gather intelligence and detect diseases early, and communicate and exchange information electronically worldwide. To understand biosurveillance is important because early warning systems monitoring data from a large number of people may not be able to discriminate between a biological epidemic and an epidemic of fear. Therefore, the need for all biosurveillance is stressed.
A combination of technology tools from artificial intelligence and biosurveillance systems to internet chatters help set the first alarm on the surge of influenza A H1N1 as early as the end of March. What is biosurveillance and its features? Biosurveillance is defined as the use of technology and its resulting prototype in detecting biological pathogens in a specific area of existence. An operating environment and an interface were used to do early detection, 24/7 tracking, and alert generation of emerging threats worldwide. A company like Veritech, who uses biosurveillance, also picked up early indications of social disruptions and behavioral changes through its network of multilingual analysts who monitor and analyze discussion on blogs like Facebook, Friendster, or even Twitter, to detect the pulse in the people.
In the best of all possible worlds, a pandemic would be controlled by worldwide surveillance, effective vaccines, sufficient antiviral supply, and adequate medical facilities to handle pandemic surges. Early detection of emerging threats to human, animal, and plant life not only aids in preventing the potential spread of the disease, but it also helps in empowering corporations, government organizations, NGOs, and global citizens with timely and actionable information. A full-scale epidemic would have enormous impact on communities and businesses. Through biosurveillance, preventive measures supporting community health management are better planned by government agencies. Effective pandemic response plans would help ensure continuity of businesses amidst the situation. Another benefit of biosurveillance is that insurance coverage can be assessed during potential health scare. Doing preventive measures in terms of vaccinations is sometimes not sufficient. Insurance coverage supported by companies for business travelers amount to a huge responsibility, especially for certain hot spots. Next benefit is that financial impact is adequately assessed and prepared for. The World Bank estimates that a severe infection with avian influenza could cost around $2 trillion and could plunge the world into a decade-long depression. The threat of global pandemic continues to move fast. Defeating it requires that we need to move faster than fast, and that is what technology does as it steps up to the plate to help save lives.
The cost to the global economy by the spread of infectious diseases can now be substantially reduced by advances in early warning and early action. Unlike in conventional attacks, pandemic diseases may not be immediately apparent. Reducing the time it takes to detect an attack can save many lives. Hospitals and public health preparedness improve mass casualty care, thus reducing costs. Companies can now strategically plan their business trips to protect their employees from countries exposed to pathogenic risks. Finally, through biosurveillance, companies can now use alternative means of conducting international business affairs with more manageable costs. Teleconferencing reduces the need for several meetings in different geographic areas, thereby protecting the employees' welfare and decreasing public involvement costs.
The recent H1N1 outbreak provides an opportunity to analyze and study the use of population health technology through biosurveillance and to learn lessons for future public health emergencies, including acts of bioterrorism. Most importantly, it should be a stimulus to critically evaluate these technologies and to provide directions for further research and development. Biosurveillance clearly has a vast potential to increase our preparedness for the next public health emergency.